This is a very exciting time for Aetna right now in Virginia. Just last month, we completed the acquisition of Coventry, which means that Southern Health is now part of the Aetna family. And so when you combine, their presence in the market with the provider collaborations we've established here in the Commonwealth, we think we have a tremendous platform to work for, in the Commonwealth and have a great opportunity for success here. When we talk about consumerism and value, here's a survey of healthcare consumers. What do they think of healthcare? Well, they think it's expensive, number one. But some of the other common themes you see up there are that it's difficult, it's annoying, and it's what was the other one? Difficult, annoying. There's another one. It's difficult, it's annoying, and it's challenging for them. So what we're trying to do is take some of the mystery out of that and make it more affordable. There's a lot of challenge that people have in being consumers, and one is the cost. And the other are all the obstacles to get information about being better consumers. So our role is to try to find avenues to drive more affordable care through collaborations with providers, and to also give the members the tools and programs they need to become better consumers of healthcare. In today's model, and it was talked about from the main podium today, there's a lot of challenges with the healthcare system and the way the payment model works, and there's not an incentive for a health system to truly improve the health of the population, because if they're successful at that, then fewer people go to the hospital and they lose revenue. Well, that's a model that can't work long term. So what we try to do is work with those health systems to build a program that pays for value, for delivering value, and reimburses them for that, so that the model can work and we can really work towards improving the cost of care. And we also, quality continues to be a challenge, and it's really about the flow of information. How can we get all the right information to the providers at the time they're delivering care, so they can make the most educated decisions for their patients? And if we're able to do that, we can improve the prevalence of evidence-based medicine and the compliance with evidence-based medicine, and end up with higher quality care for all our members. We have been very focused on provider collaborations. Our chairman believes that the current system doesn't work well the way it's designed, and that we think the best approach is to partner with the providers in the community and collaborate with them and come up with solutions about how we can better deliver care. And we have a number of tools that we use to help to facilitate that flow of information, so that at the time that the member's receiving care, the provider has all the relevant information so they can provide the best optimal care for that member. And through these tools, we've established a number of collaborations in the Commonwealth. First with Carilion Clinic down in the Roanoke market. That was our first foray into accountable care. It's been a great relationship, very refreshing to get on the same side of the table with the providers and talk about what is it we can do to make the healthcare system more efficient and deliver higher quality care. We also recently started a new insurance company in Northern Virginia called Innovation Health, and it's jointly owned by Aetna and Inova. We're 50% owners. We're both responsible for the profit and loss. If we earn money, we share in the profits of 50%. If we don't, we share in the losses. And so that creates 100% alignment between the insurance company and the delivery system, to make sure we're doing everything in our power to deliver more affordable care to people in Northern Virginia. So very exciting endeavor for us. It's the first one of its kind in the country for Aetna, and it's off to a good start, and we're excited about what that can bring going forward. And just last week we announced another alignment with Riverside for an accountable care organization focused really on the peninsula, and bringing more affordable health care options to the people in that area. We have a lot of other discussions going on across the Commonwealth on similar type arrangements, but we think fundamentally this is how we can bring more value to a consumer by working with the providers to deliver more efficient health care. The other thing is about helping people to get the information they need at the time they need to access care. And we think that mobile devices and smartphones are the future. If you look at 15 and 20-year-olds, they don't care. They don't have watches anymore because they all use their smartphone. It is everything to them. And it has become the source and the conduit of information for many people out there. And so, we think that's a great avenue to share more health information with our members. And so along those lines, we purchased iTriage, which is the most utilized medical app out in the marketplace. And it's a decision support tool that enables people, if they have a symptom, to go through the process to determine where they might best get care. And to give you an example of that, one of the features is that, let's say you sprain your ankle, and so you go in and say, I got a sprained ankle, what are my options? And you say, well, I want to go to the emergency room. So if you do that, the tool is going to go back and say, you can go to the emergency room, but you're going to sit and wait for a while, and it's going to cost you a lot of money. What do you think about going to one of these urgent care centers? Can I share those with you? And it will give that information. So this is about trying to help people get care at the right setting for their condition. And so we think it's a powerful tool for our members. The other thing is transparency, is trying to take some of the guesswork out of what healthcare costs. And we're a very significant proponent of transparency. We were the first national carrier to roll out transparency 15 years ago. We believe in it. We think it's important. We have transparency on physician costs, on procedures in the market, comparison between hospital costs, and also pharmacy tools. I think the one that I wanted to highlight was the member payment estimator tool. And this is a tool that, let's say you're going to have an MRI done. You could put in your zip code and say, I need to have this MRI done, and it will give you a list of the providers in the market, and would also give you, it would pre-calculate what your actual out-of-pocket cost is for that service. So it would look at where you are on the deductible, what your coinsurance is, and what your out-of-pocket cost would be between the various settings. So you might see that an outpatient setting would be a half the cost of doing it at a hospital, so that this will enable people to make more educated decisions about their health care and drive more value for their health care. We also have quality programs that we've established. So when we talk about value, we talk about quality. So two of the programs we have is that we have an Institute of Quality program that's geared at orthopedics and coronary treatment, as well as bariatric. So what we do is we put out RFPs, we have providers respond, and if they meet the clinical criteria and results, and they're deemed to be efficient in the delivery of that model, they can be designated as a quality provider. We have a similar program for specialists called Excel, and it's on 12 specialties. Once again, the specialists have to meet a minimum requirement of quality standards established by their specific specialty, and then if they're delivering efficient care, they could be designated as an Excel provider, a specialist for us, and they get a blue star on our provider directory. So it's another means for our members to make a selection on their health care and bring more value to their purchasing. So going really quick through all this, but I think the key thing is that what we're trying to do is to find means to make healthcare more affordable, number one, but also put more information at the members' fingertips so that they can make more educated decisions relative to their own healthcare.